So we're going to jump right into it. Before we get started, I guess I should introduce myself, Renee Brandon, Director of the Southern Oregon Early Learning Hub. And this has been a labor of love to pull together. And I really just want to thank the members of my team and the many community partners who are participating as presenters today to really talk about what we can do locally to address our childcare crisis. To get a sense for who is in the room, would you please put your name in the chat? And if you're affiliated with an organization, please add that as well. If you are a parent, an interested community member, please note that as well. We're really wanting a record of who was able to join us today. And I'm going to review now a few of the event details as you are doing that. If Jordan, you want to advance to the next screen. So we are offering Spanish interpretation. We have had an interpreter issue come up, so our interpreter will be joining us a little bit late today, and I think we have communicated that to our guests who are wanting interpretation, so it will be available soon. We are also recording this event. I'm hitting record right now, so that it can be available to those who were interested in this information but could not be with us today. The event will be, the recording of the event will be posted on our webpage, and we encourage folks to share it out for those who couldn't attend today. And due to the size of the event, we won't have the ability for folks to come off of mute and ask questions, but we want every question, every suggestion, and every comment. So please put all of those in the chat, and my team will be collecting them. And then we will put a Q&A document out along with the recording of the event so that everyone can have their questions answered and their suggestions noted, because this will definitely be an ongoing conversation. Next slide, please. And we are going to do a quick poll just to get a sense for who is represented here today. So if you would click on the description that most closely matches who you're representing today, and then there is a second question asking why you're here. You could be doing other things like eating lunch in private. So we want to know why you're here today. And so we're just going to give you a few seconds to be able to answer those questions. We have about a third of the people answering so far. We're about at the halfway mark now. Keep going. The idea was that we would have a wonderful cross-sector representation today at our kickoff event. And I think we have achieved that. So I'm going to give this a few more seconds while I describe why we are even having this event. So many of you may know the function of the early learning hubs. It's really, we function as neutral conveners and system aligners. We are focused on families who have children who have not yet entered kindergarten. And so we use data analysis and we engage our stakeholder to determine what really needs to happen in the communities to better support families who have young children. And as you are aware, childcare is definitely at the top of family concerns. And so that's the conversation we're having today. And the graphic you see in front of you is really, if we are all focusing on our own sector, head down, focusing on the task before us, we're doing good work, but we're not doing it as a system. And so really the purpose of pulling together cross-sector collaborations like this conversation is so we are all focused on the same goal, hearing the same thing, having the same foundation, and working towards those same better outcomes. And so now I'm going to end our poll so that we can all see who's in the room. So we have representation from advocacy, from our coordinated care organizations, from our faith-based community, from early learning and childcare, from higher education, from K-12, from health sector, social service, community-based organizations, government, philanthropic foundations, and interested community members. So thank you so much, everybody, for showing up for this conversation today. Okay, Jordan, next one there. So quick agenda. So we're going to start with the bad news. We're going to be looking at a lot of the regional data that we've been collecting over the past 12-ish months or so. But we promise that that's not where the conversation is going to end, because the majority of our event today will be talking about what is working, as well as those things that are just poised to launch if we can get more collaborative support, i.e. more funding to launch some of these other initiatives. And we will also hear how each and every single one of us can take a role in advocacy and what that might look like, and really the power of our voices within our local community and focusing out at the state level. Now we're just going to jump right into it. So in 2022, hubs across the state were charged with looking at childcare data. And what we learned is that of the 19,000 children in our area under the age of 6, fewer than 33% of them had access to a childcare slot. And if you look at the table at the bottom, the percentages highlighted in yellow are the access rates for both Jackson and Josephine County. So you can see we fall well within that childcare desert category. And then we wanted to know, what about affordability? So go ahead and switch to the next one there, Jordan. And so what we found was, of those 19,000 children across our 2-county region, more than half of them, 53% of them, were at or below 200% of the federal poverty level. So what that means is at least 53% of the families in our region cannot access an early learning experience prior to kindergarten without a subsidy. And so then we looked at the subsidy rates. And so when we talk about a publicly funded option, what we're talking about is Head Start, Early Head Start, Oregon Pre-Kindergarten, Preschool Promise, and employment-related daycare subsidies. And so you'll see those percentages highlighted in yellow at the bottom. You can see that for our families who are already struggling financially, their ability to access publicly funded slots is super low because there are very few slots to access. And so we have a problem there. So I wanted to make you aware of that. The next slide. Right before the pandemic, and then earlier this year, we have been continuing to survey our childcare workforce and our families seeking childcare. And these are some of the overarching feedback that we've received. So for programs who are struggling just to sustain the current level of service, they are struggling with the same workforce shortage that every sector is facing. Additionally, they are also struggling with the historic low wages and low benefits that come along oftentimes with a childcare career, and an additional work-related stress due to the number of dysregulated children, especially since children have been coming back from the pandemic and all of the stressors that were involved with young families during that time. And then for programs to be able to expand to meet the need to get out of that childcare desert designation, they struggle with finding and affording facilities and finding and paying for additional staff. And then the themes that we heard from our families, when it comes to childcare, are struggling with access in rural areas. They're struggling with affordability. They are talking about the wide array of quality experience that they would find in early learning. And then they also talk about the challenges related to equity and inclusion and their struggles to find the right fit for their families. In 2019, right before the pandemic, we did a survey to childcare centers. And we asked them what the pay range was for their teaching staff. And this graph represents that result. And so you can see that the majority, and at that time, minimum wage was about $12 an hour. Now the minimum wage has gone up a bit, but you can see that the majority of those respondents indicated that the compensation for their teaching staff was close to that bottom amount. And you'll see that there are fewer numbers at the top, and the fewer numbers represent bigger programs such as Head Start and some of our larger preschool promise programs, who are able, with federal and state funding, able to better compensate their workforce. And that what we heard from many of the community-based organizations at the bottom of this graph is because they could only pay their teachers what families could afford to pay in tuition, they really couldn't afford to give their teachers wages or increases in wages. And so they would often have to recruit folks that really didn't have very much experience in early learning. And then they would invest their time, their finances into training up these folks into high quality teachers. And then after a couple of years, what would happen often is those people now qualified to apply for some of the jobs that were at the higher end of the scale, looking for more experienced teachers. And so many of our programs not receiving public dollars felt like they were training up and out, up and out. And it was really difficult for them to sustain the workforce. So that's a snapshot of kind of the financial challenge that is being faced across the board. And then we also, in that same survey, asked them about benefits. And you can see that at that time, very few of them had medical or dental insurance. And we have made some progress in this over the last couple of years. You can see that the majority did have some type of paid time off. Although what we heard is it's really difficult for folks to take time off when there's such a shortage of workforce. And then the majority had some type of sick leave and very few had a retirement plan. So overall, what this is showing us is that the folks that are entrusted with caring for our youngest children don't always have the necessary supports to take care of themselves when they need it. And that's a problem. And now I am going to pass this over to Molly McLaughlin on my team, and she is going to talk about a survey that we did in June to the teachers in our region.
Thanks, Renee. Okay, so one of the challenges mentioned earlier was the workplace stress that teachers are experiencing due to an increase in children experiencing dysregulated behaviors in the classroom. In June of this year, the Early Learning Hub surveyed child care providers in Jackson and Josephine County to learn more. More than half of the respondents reported having 4 or more children in their program who exhibit behaviors beyond what teachers characterize as typical preschool behavior. Teachers reporting on dysregulated behavior in the classroom were most likely to note incidents that included biting or hitting or kicking peers or teachers and causing injury. Teachers also reported on other behaviors like inconsolable crying. 66% of respondents reported a significant increase in these types of escalated behaviors over the past 2 years. So we do have some graphs to share from the survey with you all. That top graph that you can see notes that 33% of teachers had noted being hurt in a way that had a lasting effect, resulting in a bruise or a wound that needed a bandage or additional care. And just want to note too that this question was preferenced with how recent have you experienced this? So teachers were asked to say yes if they had experienced this type of injury within the last 90 days. That second graph there, 80% of teachers feel that students in their classroom are being negatively impacted by some of the behaviors they are witnessing in the classroom. So yeah, quite a high number there at 80%. And then we do have one more graph to share from this survey that we've conducted. So 59% of teachers state that behaviors in their classroom have impacted their desire to do this work. I do want to note that we did get a lot of feedback on the survey, and some of it does speak to the supports that teachers indicated would help them better serve children who are needing that additional assistance in the classroom. And we will be reviewing that feedback later on in this presentation. At this point, I'm going to hand it over to Rhonda Schock. Rhonda is the owner and director of Great Beginnings Childcare and Preschool in Rogue River, and she has graciously offered to step away from the classroom and join us to share her experience as it relates to this topic.
Hi, good to see everybody. It's nice that there's so many people that are available to make time and space for this because it's so important. Pretty much everything I was gonna say between Renee and Molly, you covered it. I've been in this field for over 37 years. And the behaviors have escalated, I would say, in the last 4 years, exponentially. So within the past 5 to 7 years, I've actually experienced pretty significant increases of aggression, negative behavior such as biting, physical aggression, screaming, tantruming, furniture throwing, class demolition, as well as a greater rise in children on the spectrum and non-typical children, and a greater number of students having difficulties with self-regulation. Some of the additional supports would be additional training, compensation, alternative classrooms, more staff, parent and family education and support, safe spaces for regulating, and equipment like vests, helmets. There's just a plethora of tools that we could all use. One of my biggest concerns is the trauma that happens to the other children when these children are completely blowing out, screaming, biting, tearing apart a room. I don't see it a whole lot different than trauma at home when you have a parent that is raging. It is daily. It is, we just don't have the answer. We need to have trainings for staff that can teach them how to deal with these types of things. What do you do if you have 2 teachers to 15 kids, which is a pretty low ratio, a pretty good ratio, and then one has to be pulled out completely to deal with this behavior, but we can't restrain children, so they just get to demolish the room, and all the other children have to leave the room. And today, if it happens right this minute, I have to send everybody to another room where they can still hear everything happening, or out into the rain. I mean, it is so sad to watch it happen, and the other kids to be closing their hands over their ears, parents walking in going, what is going on here? I don't know that I could leave my child day after day, and really it's an emotional abuse, and we just have to come up with some other answers for these types of things. Better training for teachers and safe spaces, and better supports for the families that have the children that are experiencing these things, because I don't think it's for lack of parenting. I think parents don't know what to do, and it's just really a dire situation.
Thank you so much, Rhonda. We can hear the passion and the need in your voice and your story, and I really appreciate you being willing to share today your experience as a veteran early learning educator. Very much appreciated. Could I go to yeah, thank you, Jordan. So at the same time that teachers are feeling under-resourced, new legislation has passed. And so this is important to talk about. So starting effective July 2026, early learning providers who are licensed in Oregon will be prohibited from suspending or expelling children in their classrooms. And at the same time, there is also new legislation that acknowledges that that is a challenge for providers who are already feeling under-resourced, and that there is a new program to provide more supports to both the providers and hopefully also the families. And it's just worth noting that preschool children are more likely to be expelled than any other age group, and it is primarily due to behaviors, and that the children most likely to be expelled are children of color, children who experience a disability, and children with dysregulated emotions who exhibit those big behaviors that Rhonda was just talking about. So now I'm going to pass it over to Jordan Rogers, who is going to talk a little bit of what we've heard from families this year.
Yeah, thank you. So we've touched a little bit on the impact of access to childcare in our region. So earlier this year in April, the Hub was able to survey families across Jackson and Josephine County with the intention of asking how accessing childcare has impacted them. And you can see the top graph with the question, are you currently able to afford childcare? With 55% responding, no, they are not able to afford childcare. An additional 23.3% saying, I don't need it right now, but I could also not afford it if I did need it. So throughout this survey, there was 4 general themes that kind of became apparent as we were reviewing the data. The first being families are being put on wait lists and oftentimes aging out before they are able to receive those services. Families who don't make enough to qualify for those publicly funded options, but also don't make enough to afford the private pay options. There may not be access to childcare in their area, especially in rural communities, and options for families who work, non-traditional schedules or need part-time options outside of that 8 to 5 work hour.
Thank you, Jordan. And now Sydney Wing on our team is going to share a parent testimonial and then look at some of the family complexity data that our CCOs have available to us. Sydney?
So hi, everyone. We reached out to a parent that we know personally who has navigated this process while also having a child that has been diagnosed with autism spectrum disorder, and just asked her some questions about her experiences with trying to find childcare. So the first question we asked was, what was it like trying to find childcare for your son? What are some of the challenges that you faced? And she told us that at first, before he was diagnosed, we didn't want to do childcare. She wanted to be a stay-at-home mom. That financially said they were struggling. They didn't have very many friends or family to help, but it seemed doable. After his diagnosis, they lost more family and friends because they didn't know how to care for him with his new diagnosis. And some of them were afraid and didn't want to have to follow the new rules of care. She said most places were and are too expensive for us. They would not and do not take a child that is not fully potty trained, that now he's almost 8 and he still has bathroom challenges. After the pandemic, she says, I left the workforce again, but started a small business instead of going to a job. This allowed me to work around the family's schedule, to work nights and weekends when my husband was home with our child. I could also work sometimes when the homeschooling was done for the day. We have a direct service personnel come to the home a few times a week to help our son with his needs. But because of his needs, he can't go to a camp unsupervised or an after-school program without a caregiver that's not part of the program, or to childcare at this time, because it takes a lot of training and access to his individual education plan and or his individual support plan to know how to help him with his needs. She says that he still longs to play with other kids and have friends. So we can go with him to events to make friends, but he isn't able to access them without a parent yet. We also asked, what impact did searching for childcare have on your and your husband's employment? And she shared that we didn't have the money to pay for it, still don't. It wasn't worth it for both of us to work if our son's needs were so big that not many people could provide them for him or us. We became a single income household for many years, barely getting by, relying on SNAP, WIC, SSDI, and food boxes to get through. Our son gets SSDI and has an ABLE savings plan because of his disability, and it helps to feed and clothe him in addition to buying his medical and sensory needs. It is also a savings account for future college fund or to start a small business of his own in the future. But we do not have access to it like a bank account. It's his future, not our today. It wasn't until my husband got his last job where now he makes too much money for him or I to be on OHP or to receive SNAP. So I am currently uninsured. He gets insurance through his job, but we can't afford for me to be on that as well. Our son still receives OHP because of his disability. We asked, was it difficult to find somewhere that could meet your son's needs while also meeting your family's needs? And she shared, definitely. Our son was expected to behave like a regular kid because of his invisible disability. People and potential caregivers were mean to him when expecting him to do things he couldn't and frustrated at his reactions to their actions. It was easier to take care of him ourselves, and eventually we qualified for a state in-home caregiver to come to our house. But he can't see, be watched, or play with other kids during that time. He still wanted and wants to play with other kids. He just doesn't get to do that through childcare programs. And the last question that we asked was, how did finding childcare or schooling for your child change your family's lives? And she said that his needs were so big that at first we didn't want to have more kids. And then after a while, we just couldn't have any more kids physically, no matter how hard we tried. We have even been to the doctor about over the years that he's our rainbow baby, and it looks like we were very lucky to even have him. He asks for siblings, but we can't make that happen for him. Childcare was our hope at him having peers, but a lot of places are just molding him into the child that will fit into society, even if that's impossible. There needs to be more inclusive childcare opportunities in the Valley with behavioral and trauma-informed care. That there are so many kids with big needs getting kicked out of daycare and schools, but if their teachers had better resources and supports, those kids would thrive too. So even finding childcare still didn't solve all of those problems for her, but it definitely helped.
Thanks, Sydney. It sounds like we might be having some interpretation channel challenges. Is that still correct, Jordan? Are we struggling there?
I think so. I believe Tomas is here, but it doesn't sound like anyone can hear in the Spanish channel. So if everyone is able to select the interpretation function and choose the English or the Spanish channel, I believe that would help in getting it working.
So we'll take a moment while everyone clicks the icon at the bottom that says interpretation and choose the language option of your choice. And while that is happening, I want to share an anecdotal story about that particular parent. She has been engaged with a lot of the early learning work over the last several years. And when she saw this preliminary data, she teared up and she said, I always thought it was just us not doing the right things, that we weren't working hard enough and that we just weren't doing the right things for our child, versus what she now understands is that it's a system problem. The system needs to be overhauled, and the supports and services for our childcare workforce and our families need to be prioritized. So I wanted to share that as we're waiting. Okay, so now how does it feel, Jordan? Is it working now?
Tomas, I see you are off mute. Are you in the interpretation channel? Okay.
It's working?
Yes, it looks like it's working. Awesome.
Wonderful. Yes, we continue to learn and grow with our translation and interpretation goals. So thank you so much, everyone. And now I'm going to pass it back to Sydney, who's going to quickly walk us through some of the coordinated care organization data related to family complexity.
So looking at this data that we have received from our coordinated care organizations, this is for Jackson County, where we see a lot of numbers and a lot of needs for family. And a lot of times between Jackson and Josephine counties, people seem to think, well, that must be a Jackson County problem, or that must be a Josephine County problem. But we're going to look at the next slide for our data from All Care. And there is a less than 10% difference in every single category. Some of them have had no change at all. And so it's not just Jackson County. It's not just Josephine County. Everybody has all of this happening, that it's both counties. We're equally complex.
Thank you so much, Sydney. Families have a lot going on. Children are nested within those families. Childcare providers are doing their best to respond to the needs of the families and the children. And as system leaders, this is really a call to action that we need to figure out what to do. And we will be talking quite a bit about that today. So just a real quick look now on when we talk about how expensive childcare is, wanted to kind of break down. So for those of you that are not in the field, you kind of get an idea of why there isn't more childcare available and why it might be hard for families to afford it. And so for this slide, I've used Preschool Promise as kind of the proxy for this. And Preschool Promise has two goals. One is to fairly compensate their teaching workforce. And then the second goal is to get more access to children whose families cannot afford it. And so providers who are participating as Preschool Promise programs get a reimbursement of just under $14,000 a year per child. Their maximum classroom size is 18. The teacher to child ratio is 1:9. And so that means that the cost for one class of 18 children is just over $250,000 a year. And another way to look at that is $1 million buys about 4 classes of high quality preschool. And just a note that this is preschool. And if we're talking about infant toddler care, the adult to child ratio is even tighter. And so the cost is even more, about $18,000 or so. So you can see that there really are a lot of challenges around getting more subsidized childcare quickly across Oregon. And then let's look at the cost of not having enough childcare, for Oregon not to be investing in childcare. These are just a few data points. So the Oregon Child Care Research Partnership has said that it estimated that it's costing our state about $2.15 billion per year in lost productivity, lost earnings, and increased public assistance. Also noting that childcare workers across the country are 98% of the worst paid professions when they are focused on caring for our youngest children. Of course, this isn't every program, but as an average, we have a lot of work to do. And then women are 5 to 8 times more likely than men to experience the negative employment consequences of childcare challenges. So we can't afford it looking at that price tag, but we really can't afford not to figure it out. And that's why we're having this meeting today. So when we look at who's impacted by childcare, it's not just parents, it's the workforce, it's every sector. And our Oregon workforce boards have identified lack of childcare as one of the key contributors to the overall workforce shortage. And a couple of examples: if childcare isn't available or affordable, a single parent remains on public assistance, or as our parent testimonial talked about, a 2-parent household only has 1 employed parent, and they continue to struggle financially, relying upon every public system they can just to make ends meet, trying to provide support for their child. And we will not have enough childcare to support all of the other workers if we can't recruit and retain a well-compensated childcare workforce. And then the second argument is really that there is a very documented return on investment for a child receiving a high-quality preschool experience prior to kindergarten. It has been shown to reduce special education in the K-12 system because needs are identified earlier and supported earlier. It reduces early learning and K-12 teacher attrition due to burnout from having those high numbers of dysregulated children. And quality early learning is linked to higher 3rd grade reading scores, which correlate to lower dropout rates in high school and into the workforce, productive adults. So we really can't afford not to figure it out. And then this is just really a snapshot of who's waiting right now. So right now, my team coordinates placement for preschool promise programs. And we have, at the last data point that I looked at, we had 166 children waiting to be placed. They don't have a slot, they're waiting. And Southern Oregon Head Start leadership recently shared that over 1,200 children are on their wait list. And the reality is that many of these children will just age out. They'll age off the wait list without ever having had that early learning experience before kindergarten, because there weren't enough slots or subsidies and their families just can't afford it. They can't afford the cost. And so we wanted to pull this meeting together to really get the message across that everyone has a role in this crisis. For some people, it will be advocacy, and that is really powerful. For other people, there are other organizations, there are funding streams that you may be considering, like how can we best support the needs of families with young children? And so we wanted to make sure that everybody had access to this data to see if there is a role for you or your organization in supporting some of the efforts that we're going to be talking about shortly. So that's all of the bad news. So that's all the bad news I'm going to share today. I think it's enough. And the rest of this is all about the opportunities. It's about the things that are happening right now and the things that could be happening really soon with enough partner collaboration and energy behind these efforts. And so there are 4 quadrants that we have identified through data that we're going to be highlighting today. And the first is the need to get more childcare in our rural communities. And so we'll highlight some of the strategies to be able to do that. The second is increasing the subsidies within existing childcare programs, so more children can get those slots within the existing programs operating today. The third category of need is to build the early learning workforce. And, I think I'm just going to back up for a minute because I don't think I stated this at the beginning. During this presentation, you'll hear those of us speaking say childcare, preschool, early learning. And for the purposes of this conversation, we're using them interchangeably because we're talking about a high quality early learning experience prior to kindergarten. So I just wanted to make that clarification. And then our fourth category goes to what I think Rhonda very eloquently described is the need for more supports. Our teachers need more training in areas. They need more hands-on supports in areas. There is just a lot of need, more need than there's ever been before. And we want to make sure that we are responding to those needs. And so the rest of this is unpacking each of these quadrants one at a time. And we're going to start with rural communities. And Teresa Slater with the Early Learning Hub is going to kick us off.
Thanks, Renee. So as Renee was telling, the bad news is past, and now we're talking about all the things that are happening in our region and ways that we can collaborate. So one of our concerns is the availability of childcare or early learning experiences in rural communities. Currently, there's no licensed childcare in 14 of our rural communities. And when we talk about our region, we're talking about Jackson and Josephine County. And as you heard Sydney say earlier, there's very little difference between those two as far as the needs of our families. So we have 14 rural communities currently with no resources for early learning for their families, which a conservative number would be about 200 children and families without a child care option. So as we were addressing this, and we have been addressing it, this is one of the main focuses and the priority areas and priority populations of the Early Learning Hub. Back in 2017, we put out requests for applications, an RFA, for rural communities to offer early learning opportunities. And we had an application come in from the Sugarloaf Community Association. And we went out to Williams and had a wonderful conversation. And this community had rallied. At the time that we met with Jessica Casey and her team, the Williams Elementary School was at risk of closing. This would have devastated the community. And as we met with them, they presented us with an enormous amount of data. They had already surveyed the families. They had already talked to them and asked, what would be needed out here? What do we need? And at that point, they applied for our grant. That was in 2017. They were awarded the grant, and we walked side by side with them as they built their program. They started with a small number of children until they got their foundation underneath of them. They are currently serving 20 children, and they have been awarded a Preschool Promise grant, which means they are one of the highest quality programs. So we went from this opportunity of putting a request for applications out 2017, we fast forward to today, 2023, and that Williams that Sugarloaf Community Association within the Williams Elementary School is thriving, and they are doing so great. And I'm going to pause for a moment because I really want Jessica Casey, their lead teacher, the energy behind this program, to have an opportunity to share the impact that this opportunity had on their community and on their families. She was at that very first meeting. She's been walking this walk with us, and we have been walking it with her. And I'd like you to hear directly from Jessica just exactly what it's meant to that community to have this project. Is Jessica on?
I'm here.
Hi, Jessica.
Thanks.
Thank you.
If my it gets weird, I might have to turn off my camera, but here we go. Thank you for letting me share about our program today. Teresa got through a lot of the nuts and bolts of our program and how we became to be right now. It has been an overwhelming response from our community since our first surveying. We really wanted 10 kids. That was our main goal to begin with. And I think we ended that first school year with 16. And, you know, the elementary school in our town, I mean, we are a very small town. We're under 2,000 people. We're semi-isolated. So there was great opportunity to build more community, and the school was really struggling to do that. Teacher burnout, all kinds of reasons. Our kindergarten teacher at the time was so overwhelmed with incoming kinders not being able to even be left at school, let alone make it through an entire day. So through this, we've really built trust with our community through our relationship with the school. Parents and kiddos are super comfortable. They know their way around the school. They know staff. By the time their kiddos are heading into kindergarten, they know the teacher. The children know the teacher. We have a great relationship with our K teacher. We do a lot of activities together. We bring parents into that. So there's a real familiarity for parents and families. Pickup was always interesting. You know, parents were very spread out, not really talking. And then year after year, you can see how throughout the year with our activities and bringing parents into what we're doing in the classroom, the group of parents gets closer and closer together, where now they're chatting, they're doing play dates, there's social opportunity. We have family engagement events and dinners and field trips together. And what it's really done is, now I should back up. Now we have children in 5th and 4th grades who were in our class when they were in preschool. And that's an incredible lens for us to be able to see these kiddos year after year and see their growth within their own little social worlds at school, and also their parents. Their parents are still their friends. They're in this journey together. And I think that was one of our goals is, as parents, you'll see those same faces from kindergarten and sometimes through high school. A lot of times, most of the kids go to high school together. So we wanted to create a real learning community where parents can lean on each other, get resources from each other, and really be soundboards for each other as well throughout their children's educational experiences. And it's created, now when people in our community are looking at schools, looking at education, Williams is looked at as a pre-K through 5th grade school now. Our community, it's a very natural progression. We had kiddos not starting school till 1st grade. We had, like I said before, kiddos not, never been in any experiences in kindergarten. So we have this really whole family support going. And we coordinate with the elementary school as well with services for families. We have their family outreach person that we coordinate with if kiddos need clothes or families need other services, especially kiddos going into kindergarten. They can go into kindergarten with supports. We can identify kids earlier, which is really helpful with parents, working with parents to support their children so that they're going into kindergarten with supports that they need. And parents still lean on us. I still get phone calls from parents whose children were with us 2 or 3 years ago that they need to chat and need to work something out with their kids' education. And yeah, we've really just become a trusted, familiar, needed place. And throughout all of this work that we've done, it's these opportunities aren't going to plop themselves into our communities. They're not. It's up to us, community leaders, educators, and families. We had like the perfect combination of people when we started this endeavor, and that's really what has kept us going and afloat this whole time. We can't do it by ourselves, and it does take a village, literally. Just looking at all the people here, there's like 7, 8 folks that have helped me personally throughout the years and helped us grow this community with our families. And even though we're doing so well and we're so successful, it's not enough. Our community still has children that we are not able to serve because of our size limits. I mean, 20 is quite a lot, but we still have a waiting list, and there's still work needed for sure, but we are doing something wonderful and building on a great foundation.
Thanks, Jessica. That is such a great tribute to the power of partnerships and how it has changed the dynamic in Williams. So thank you, and thanks for sharing that story with us. So what's that next phase? What can we do? So we take this example and we say we want to replicate this. And Jess knows that we've talked about this throughout our partnership with her about once she kind of flies the nest, so to speak, how we want to take this funding and go to another rural community. So community partners can come together we can add funding to the hub's available funding. What this would look like is a repeat of what happened with the Williams and Sugarloaf Community Association partnership. We would release an RFA, request for applications, to existing rural community partners. We look at a readiness rubric. You know, I mentioned in the beginning when we showed up, they had already done all that work. It was amazing, the information they had from their families. So we would go through that process. We've had a group of people aboard that would review the application, select one new partnership for a 2-year subsidy. And then we want to nurture and build that program again, so that the hope would be in the future that they would be poised and ready to apply when there's another preschool promise expansion. I talked to Jess and her group for a couple of years about how to get ready to become a preschool promise for when that expansion did happen. And then we step back out, just like we've done with this example, where we back out of our funding because something else has come in. These programs cannot survive on a private pay. They need that subsidy. And then as those donations come in, and then we would be able to move to another rural community and just continue that cycle. It's successful, it's proven, and it works. So what's that look like? What kind of funding would be required? It does vary, and it is dependent on the community and the needs of the community, but an estimated $60,000 per year per classroom. And then in this case, the Three Rivers School District and Williams Elementary has provided the classroom. They've provided quite a few extras to them, but one thing that is necessary is a classroom space. And so we would be looking at about $120,000 for a 2-year contract with a new rural community that has met that readiness rubric. The hub, of course, has some available funds, and we could set aside approximately $20,000. But the hub's role is to bring the system together and show how we can all come together and we can all partner and make these things happen. This project with Sugarloaf was a strong collaboration between ourselves, Sugarloaf, Williams Elementary, the Three Rivers School District, and the community of Williams itself. So that's what we need in more rural communities. As you saw up there, 200 plus children are without early learning care. And we could impact up to 20 children per site. And as you heard from Jess, that they still have a waiting list. So as we talk about this expansion into the rural Jackson and Josephine counties, we're talking about that there is no licensed care. So we have another focus that we'd like to share with you. And this is also another proven strategy that we've had in the past. So our goal here is provide startup costs and wraparound supports to 2 individuals interested in starting in-home childcare business out in the rural communities. We've done this in the past, and there may be people on this call who have applied for an application through the Early Learning Hub. We're really looking to build from those communities. You live in the community, you see the need in the community. So we would put out an application, And with the help of all the partners, when we talk about the partners, we're talking about, you know, CCRN, Child Care Resource Network, about the small business departments, and how they can come alongside an individual who says, I want to provide this in my community, but how do I do it? So what we would do, and we've done this in the past, we put in an RFA and people come, or organizations, I shouldn't say organizations, people, individuals come forward and say, I want to do this. I want to stop for a second and I want to reflect. Many years ago, I started a preschool when my kids were very little. And I was reflecting with Renee and I said, you know, I remember back when my kids were very young and I was able to apply for a startup grant for my preschool. And it was a game changer. It opened my eyes. It opened my world to the possibilities of early learning back in a day where it didn't feel like it was prioritized. This can change the trajectory of not only the business owner, but of the community, like we heard from Jess. So our strategy is really to put out an RFA, provide some startup costs. It looks like, you know, as we walk through this, about $5,000 for a startup costs and about $38,400 for tuition assistance. We understand that an individual doesn't have the capability or the availability to start a business from scratch and scholarship families. This business, it really relies on the payments of families or subsidies. So we would come forward and we would need to find funding for scholarships up to 4 families, and $43,400 would be the total cost, which times 2, because the Early Learning Hub works in a biennium process. So that'd be 2 years. So we're looking at $86,800 for 2 childcare sites in rural communities. The hub could contribute approximately $10,000 to that. And we would need partners to come alongside us to partner with us to focus on the expansion of these rural community sites. This is a proven process. We've done it multiple times in the summer to bring additional bridge funding to summer programming to allow children to have those early learning experiences prior to the entry into kindergarten. We want them to have the most successful transition possible for the families and the children. And this is an absolute proven way that we can do that with everyone's help.
Thanks, Teresa. And I just wanted to note for those that may not be aware that a family child care provider can have up to 10 children in their care. And so this strategy is really to provide a subsidy for 4 of those 10 children and allow tuition-based private pay families to fill in those other 6 slots in those communities, or however many that provider chooses to serve. So it would be kind of a mixed delivery model in terms of payment. So that we're pretty excited to see this one move forward. So thanks, Teresa, for highlighting our focus on how to get more childcare into rural communities. And now we're going to shift to the next quadrant, which is some strategies to expand the supply within existing programs. And I'm very happy to have Sunny Spicer with the Children's Museum of Southern Oregon and the Ivy School come and talk about a couple of examples that she's able to share with us and hopefully get some excitement around. Sunny, take it away.
Thanks, Renee. So one of the strategies that we have done is to work with school districts in the area. And our one of our most successful partnerships is to work with the Medford School District. We're also working with Talent Elementary. We now have 7 classrooms with Medford School District, and that's a collaborative effort. The Medford School District not only provides classrooms, and we now we're in 7 elementary schools. Medford School District helps cover the cost of those programs in addition to providing the space. And you've already heard a little bit about the benefit of being in elementary schools, what that does for the families, builds those connections to the elementary schools, helps kids get more connected to those schools. Apologies, I'll speak slower. And it also expands the capacity in the region. So, and I'll also note in these programs, for every spot that we have, we have 3 people on the waiting list. So it's also incredibly popular. And it's building good connections for those schools. The teachers have very strong collaborations with the kindergarten teachers, and they become part of the whole school community. So we've talked a little bit about those numbers, with about 50% of the families being unable to afford the tuition. We find that in our programs, about anywhere from 15 to 30% can afford private pay. And then we have that sort of section in the middle where they need some level of subsidy. So what we've done with our elementary school programs, we have about 50% of those classroom spots. We bring preschool promise funding. The school district then supplies funding, and then we create a sliding scale. And then to do wraparound, because preschool promise is a school day program, we provide wraparound funding so that families who need full day care, we bring private pay funding to that. So that's really the sort of the cost structure to this. And it's been incredibly successful. We've been able to add about 140 spots to our program. At Talent Elementary right now, we're at 20 spots and hope to expand more as soon as space is available. We've been in talks with some other school districts as well. And this is really a great way to develop those great school connections and expand capacity in a really resourceful and efficient way. And then moving on, another way that we're looking at expanding, and this could be at school districts or other places, looking at ways to engage the private sector as well, either with healthcare providers or other business industries, because this healthcare industry and also other job industries, we know that when people want to work, that childcare, as we've talked about, is one of the biggest hurdles. And so how can people that are wanting to engage their workforce, how can we get them the childcare needs, how can we get their childcare needs met? So we've been looking at OCF and some other funders at ways to create funds that they could contribute to, and then working with childcare providers that could then have these funds designated. So one of the examples that we're working right now with JRHA is to have a classroom of 20 kids that employers could then contribute to, potentially bring in other funding. The example would be a classroom. I'm looking at the question. Okay, the questions will be there later. With the preschool promise model, looking at about $250,000 per year per classroom, and then we could supplement it through those funds, and it would be designated through the OCF fund. So it's a really great way for employers and potential other private funding to come through. Those funds would be could be donated, and then it would be a tax-free donation, and then it would go through the nonprofit providers, and it'd be a great way to actually get access. It could be on a sliding scale again, and build capacity that way.
Awesome. Thank you, Sunny, so much. And now we are going to shift to Paula Hyatt with the Ashland City Council, who has a pretty amazing, and I would have to say lightning speed example of what city government can do when it's motivated. So Paula, take it away.
Thank you, Renee. I usually don't hear lightning speed and government in the same sentence, so that was nice
Right,
to hear.
right.
Thank you. In Ashland, we have many challenges that we look through the lens of affordability, and clearly, I know many are aware that housing is a challenge across the state, and that is a key issue here in Ashland as well. And when we're looking at affordability, we understand that the runway on that one is a little long. So where else can we make an impact and help our families? And thank you, Tomas, I apologize. Thank you. And in looking at our options to help our working families, it was very apparent that there are great early learning needs in our city, and that the ownership and how to navigate those needs isn't housed with any one entity. It's not a public-private issue. It's not a municipal issue. It's not a school district issue. So who takes a hold? And we as a community have pulled together a variety of partners. And those partners include the Ashland School District, local, public, private entities, and our city as a whole. So we, in our 23-25 biennium budget, included $240,000 for early learning needs. Clearly, the children are the focus. Helping our working families is a focus, but the city and the council are acutely aware that it's also a nexus with our economy, and it is also important to having access to a strong pool of workers. And I know that prior parts of this presentation have highlighted that early learning and childcare are necessary to support the economic needs of a community. It's necessary to support availability of workforce for those who want to work and for those who want to seek that next step in education. So with that, we created an early learning ad hoc committee here in our city, and that has been convened to look at our environment as a whole, to look at what the state has to offer, and to look at the programs that are currently out there. And what we are finding in that is that we have a gap in our community that fits of those 4 elements that were in the prior chart. The don't make enough to qualify, but don't make enough to afford. So the council went ahead and approved a pilot program, funding it with $100,000 worth of seed money from that which was appropriated in our biennium budget. We sought applicants from our community, and we have awarded the Ashland YMCA and the Children's World Montessori both with pilot program grants. The YMCA will be offering new seats that were not currently established in our community, and they will be partnering with Ashland School District, who has been exceptional in all of this work. We have members of the school district that sit on our ad hoc committee, and they have also been partnering with the Y in terms of space, the model that I know Sunny mentioned, and I think Teresa and Jessica before. So they are working in that avenue. And then one of the big gaps that we are clearly able to identify in our environment, and I'm sure it is throughout Jackson and Josephine County, is we don't have a lot in toddler care. So the Children's World Montessori program is one of the few in our community that does offer that type of care. So the city is excited to work with them in this pilot program and to further support that core need. In addition to this pilot program, the city is laser focused on having our ad hoc committee assess what is going to have the biggest impact long-term for Ashland and Ashland working families, with the goal of addressing the affordability and the access. So with that, we have had the benefit of speaking with Renee, other part-time programs. We have many part-time programs in our community. Where we're finding a big gap is actually in the full-time, which is what folks need if they're going to be going back to a standard type of 9-to-5 situation. We've also had the benefit of hearing from folks from Business Oregon and other state agencies. And our next steps will be to fully analyze our environment, identify gaps, which I know many of us know are often the toddler and the infant care, and in our case, full day programming. And then finally, what are the steps for municipal government? Because municipal government doesn't necessarily go hand in hand with early learning in a logical sense, but there's absolutely a role. And one thing that we've already found is the need for our city to navigate the zoning, because many of the programs don't have a brick and mortar location. And then when they seek that brick and mortar location, it often isn't zoned in a way that supports the program, which requires a conditional use permit. So that's an interesting thing that has kind of shaken out for us in our research and in our work in this area. And it is actually an area where the city does have a lever that it can navigate and be of help. So we continue to work that and hope to find ways where the city itself, the municipal government, can partner with the subject matter experts like the YMCA, like Children's World, to develop solutions that can work for our little town.
Thank you so much, Paula. Truly remarkable work and a really great example that we're wanting to share. Before I jump into the last example in this particular category of need, I just wanted to acknowledge that there are a tremendous number of great questions in the chat. Please keep them coming. And remember that we will be collecting all questions, comments, and suggestions, and we'll be responding to them and getting all of that out into a document for everyone that is interested as a reference tool. Thank you for that. And then the last category, or the last example in this category of ways to expand slots, would be something that the Early Learning Hub would be holding. And so this would be looking to donor partners from a cross section of Southern Oregon with the idea of subsidizing slots in various programs across our 2-county region. And to give that example, the cost per slot for preschool is in the range of about $10,000 to $14,000 a year, depending on the type of care. For example, family child care providers have less overhead expense, and so their cost is less. And then it would be about the range of between $12,000 and $18,000 per slot for infants and toddlers, just to kind of get that idea of what we'd be talking about for being able to get slots subsidized across the region. And so what we would do is find the early learning programs across Jackson and Josephine County that would want to participate in receiving some subsidized slots. And then we would market this opportunity to families in the area who would want to apply for those subsidized slots. And they would have the option to read about, visit, learn more about each of those programs and determine which one of them or more that they're interested in. And then what we have is an electronic lottery system so that everyone has a fair chance. So say there would be 20 slots across the region and we have 80 families who would be applying for them. We would use our random electronic lottery tool to select the 20 who would then be able to submit their eligibility documentation. And we would have the structure to provide a full subsidy for those families that are below 200% of the federal poverty level. And we would also be able to accommodate a sliding scale for those that we've talked about that are over the 200%, but still cannot afford childcare. And we've also heard from our families that flexibility is important. And so we could also, in partnership with those early learning programs, offer part and full-time slots to really accommodate the need. And in some cases, maximize the number of children who would have that opportunity. And I just want to emphasize that we already have this process in place because this is what we do for preschool promise families. And so it's not a matter of building this system, it's already in place. And so what we would need would just be the funding to subsidize the slots, and then we would be ready to go. And I also want to emphasize, and this goes for all of the funding that we're talking about today, that we're asking, partners to consider leveraging funding with us, that 100% of all donated funds goes directly into the community, that we don't take any for indirect or administrative costs. So our year for goal 1 would be modest. It would be to increase 10 preschool slots and 5 infant toddler slots. If we received more donations than that, that would be great, but that is our goal for the first year. And then we would want to replicate that every year as partner donations increased and as programs in the area were interested in offering up more of those slots. And so the cost would be up to $140,000 for those 10 slots for a year for preschool, and up to $90,000 for those 5 slots for infant toddlers, with the hub having $35,000 available to kick off that fund. And so we're hoping that over time we can start to build that funding source up and offer this additional opportunity to families in the area, knowing that, it really is one drop in a bucket at a time, that we know that we cannot meet the demand fully, but we do know that we can do some things. And so these are the things that we can do. And so we're going to start with what we can do, and then over time we would be expanding as we can. So next, so that was it for that second area of need. Now we're shifting to building the workforce, and we're back to Teresa Slater, and she is going to share about a successful initiative we've had going for the last couple of years and our plans for expansion.
Thanks, Renee. So as we're talking about the shortages of opportunities for children and families, we also need teachers in the classroom. There's a huge shortage in the workforce. And I know many of you are on this call living that life and understanding that. But what do we do about it? So we talk about how we need more opportunities and more people walking into the field. So a few years ago, we partnered with Project Youth Plus, and we did a very small pilot where we opened up paid internships for high school students. And it was for 6 months until the end of the biennium. It was wildly successful. And the next biennium, we opened it up to every high school in Jackson and Josephine County, working with Project Youth Plus to do the coordination of that. When those students walk through that program, they come out and they are employment ready. They have the training that is necessary, and they have the skill set, and they have the experience to allow them to experience what it's like to be an early learning educator or teacher or classroom aide. So we have done this in the high school, and it is a current project of ours, and it is expanding. And so we thought, what a great opportunity to expand this. So we do youth, we started out with high school, and then it was so successful that we opened it up to all youth. So that is 16 to the age of 24, and are now focused on adults. If we can do this with students, what a great idea to offer this opportunity to adults. So through a partnership with the Hub, Child Care Resource Network, Road Community College, many early learning programs that are already in need of additional staff, Rogue Workforce Partnerships and WorkSource Rogue Valley. We are creating a pathway for adults. So as adults walk through the door and they're seeking employment, that early learning is a great option for them. And how can they do that? So as this is already a proven program with us, with the youth, we feel it will be streamlined to replicate into the adults. So year one, we would, our goal would be 10 adult participants, 10 adults walking into 10 programs and working in these paid internships. Subsequent years, we'd like to continue to add 10 interns each year. How are we going to do that? Through partnerships. So currently the cost is about $2,400 per participant, and they get 150 hours worth of experience. So the cost is really to pay the intern, to pay that adult to work in the early learning environment. So they gain the experience, they gain the training, all while really building a career for themselves. As I said, we're working with RCC and workforce. So maybe they walk through those doors thinking, oh, I just want to do this temporarily. And it opens up this idea of a career and they stay in it. The impact could really be 10 entry-level assistants each year. That's 10 participants, but that's impacting also possibly 10 different programs that they would have additional staffing. So we need partnership, we need collaboration with the community to make this project really happen with the adults.
Thanks, Teresa. Yeah, we know that really great opportunity for youth, and now we believe that with the funding to support the adult internship cost that we can definitely replicate that. So thank you very much. We're going to continue on with the second strategy to build the workforce, and Bridie Mendoza-Moore with Rogue Community College is going to talk about a new concept that RCC has developed that we would like to see come to fruition in 24-25. Take it away, Bridie.
Okay, thank you, Renee. So we have, of course, heard the need, and we watched the dip in enrollment, the drop in enrollment through the pandemic, and we are seeing recovery from that, which is really encouraging. A big part of that sustainability and recovering has been due to our subsidized educational cohorts that we currently have running. We're currently serving 107 students funded through Southern Oregon Early Learning Services and the Early Learning Professional Development Consortium. And 303 students have been served over 6 years. And what this looks like is students moving through the classes to work towards their certificate and degree, further on to their degree, moving through as a cohort. So they're meeting once weekly to go through their classes. They have the same instructor, they're with the same students, and they're getting that additional support that they need. And the textbooks and funding, the tuition is all covered. So that has been really successful in supporting and bringing in new folks into the field, as well as supporting those who are already out in the field and wanting to further advance their education. Those students are RCC students, so they have access to the additional RCC support systems, whether it be financial aid advisors if they choose to pursue something further, early childhood education advising, bilingual advisor, counseling, tutoring, disability services, connection to community sources, and our education club. So those are all additional supports that those students are receiving. One of the real benefits I see to this, in addition to all of those, which are wonderful benefits as well, is that the way the system is set up, there's work on the back end, but when those students call, they have a very simple registration process, and they have a warm embrace, an invitation into the classroom, which I've recognized has reduced some of the barriers that I see students encountering in accessing scholarship funds, is that they often need to take several steps to access those scholarship funds. But when the funding is set up to where it supports the development of the classes, then the students can simply come in and be a part of the class without having to access additional scholarship funds. And just to share another quick example, we ran a new course in the fall called Family Education and Support, where students could get their RCC credit, but also come out with certification in the protective factors framework, which is a community goal to help saturate the community in this training. So we were able to receive funding through the Hub and Southern Oregon Success to pay for the class, so that then we could all we had to do was simply invite folks from the community, connect them with RCC to get them registered to begin or renew their commitment to their education through RCC. And we had a wait list of students. We weren't able to serve them all. So it was another example of how paying for the class simplified the process for the student. The challenge with the current cohort model is simply that it's able to offer 1 to 2 classes per term, and it's tailored to meet the needs of the student who are currently employed. But so that can kind of stretch it out, and that works really well for folks who are currently employed. They might have families, they can only do 1 or 2 classes at a time. It's a great support for them. But when we talk about the need in the community, we also want to think about how we can fast track students, how we can get students trained up and ready to enter the workforce faster. So we have been talking about and developing this idea of a fast track for students who are not currently working, so they would be able to devote more time to getting that trained up and ready in their field. And we have 2 different paths. One would be for teacher assistants, who we could get skilled up in 1 term. And one would be for lead teachers, who would be skilled up in 2 to 3 terms. Again, the idea again would be to have these folks really be ready to hit the ground when they're done. You know, they've completed their state trainings, they have their criminal background check, they've had hands-on experience in a practicum, and they're debt-free and ready to work. And that's really what we want, so they can put their energy into learning the job. So the fast track idea of launching a fast track would be serving at least 10 students in the teacher track and 30 students in the teacher assistant track, which comes out to about 10 per term. So we'd be looking over the course of a year. Per term, we could do 3 cohorts of the assistant track and one cohort of the teacher track through there. And we're looking at the costs in terms of the classes, because that's what we want to do, is be able to offer the class. So for the teacher track, there's 6 classes plus a practicum, which totals $25,300 per year for the cost of those classes. Then we're able to invite as many students, up to 25 students or whatever we cap it at, to invite those students to join in those classes. For the assistant track, there's 4 classes plus a practicum, a 1-credit practicum. And so that's looking at $17,300 per term to offer those classes, again, for up to, we'll say, 25 students in each class, or $51,900 for 3 terms, which would get those 3 sets of teacher assistants to go through. That would be also, we'd be providing them that additional support, easy onboarding, so that they can get started and get moving and get out into the community.
Thank you, Bridie. When Bridie first outlined this idea, I told her this is the best idea I have heard in so long to get people to work faster. So this was really wonderful. And as Bridie mentioned, the beauty of this is that it's a cost per class versus a cost per student. And so that we're really able to leverage that and hopefully get more interested students into that. So thank you so much, Bridie. Really excited about that. Next, Devin Finley with Child Care Resource Network. is going to kick us off on this, the fourth and final quadrant of need by describing the types of supports that are currently available to the child care workforce. Thank you, Devin.
Yeah, absolutely. So we've heard from Rhonda and others about the issue. Lots of children are experiencing behaviors, they're dysregulated, and this is distressing not only to the child, the individual child involved and their teacher, but really to the entire classroom. It's impacting actual learning moments for the whole classroom, and that is overwhelming our teachers. We are aware of this, and we are all doing our best to offer supports. So Child Care Resource Network, we are the designated agency for Jackson and Josephine County for training, for technical assistance, and coaching for the early learning workforce. We work very, very hard at offering the professional development opportunities. We work with local trainers. We're connected statewide with other CCRNRs, and so we have access to the statewide webinars. We also try to connect with any partner agencies, conferences, any of those educational opportunities for our providers. And then, as you've heard from Bridie already, we also have partnered with RCC and with SOU so that we can also get access to college level early childhood education topics for those providers. It's just a much deeper dive. It gives them the information that they really, really need. Our staff at CCRN also includes some people focused very specifically on age groups and topics, and we provide supports on those areas. We have staff that support Preschool Promise with coaching, technical assistance. We have an inclusive support program, and that is specifically to reach out to support programs, the children and their families for inclusion issues, behavior, or special needs. We have an infant toddler specialist, and we have a business support program. All of the staff members that support these specific areas, they have networks. So they have, when we reach out to early educators, we're really offering a very deep dive as far as supports go. We're asking the people who are involved with the networks to commit the time for a year, sometimes 2 years, to get education, to get engaged with their peer learning community, to get special trainings focused on them, and special resources. So we're really asking above and beyond of their day-to-day work to commit beyond that and to really do that deep dive. And then we're providing all the extra supports related to that. And that is something we've needed for a long time, and we're really grateful to have the staff that we do have. Again, the training and technical assistance that is offered through us, through the rest of the staff, are kind of more general supports. We're all available to help early educators when they need technical assistance. We try to do this. We know they're busy during the day. We can do site visits. We offer trainings in the evenings, and we can move our schedules around so that we can support folks when they need that support. We do work with a variety of partners in the area, such as early intervention, early childhood special education. And when we have those specific scenarios, we make referrals and work very closely with them to help support the children in the programs. Sorry, I'm still looking at my notes here. So early intervention and early childhood special education, they are the designated resource for direct services to children who are experiencing a delay or a disability and their families. So that's a partner we work very closely with. Like the programs themselves, we have limited capacity, and we're seeing this with our partner agencies as well. We are here to offer these supports. We need more staff ourselves, and we're working on that currently, looking for some great additions to our team. But I think I've covered mostly what we do. We're here to help and do whatever we can to connect with and support our early educators.
Thank you so much, Devin. We're really lucky in Southern Oregon to have such high caliber support for our early learning workforce, and we are very grateful. The rest of the discussion on this last quadrant of need are some of the opportunities that we would like to have going forward. And the first is something that the Department of Early Learning and Care is leading. And that is really investing in increasing capacity for every region across the state to have infant early childhood mental health consultants available to our child care workforce. And so we hope soon to hear the results of an application process. Our region brought partners together and to determine who wanted to apply for this opportunity. And our region's Relief Nursery Family Nurturing Center is the regional applicant. And the idea is there's about $348,000 available to the region over the course of 2 years. And because we do not currently have any infant early childhood mental health consultants ready to go, the first year would be the getting ready year. It would be getting folks trained to have that credential. And so this service would actually be available to our child care workforce in the 24-25 program year. We're very excited about it. When we did our teacher survey that Molly kind of gave you a little bit of a few data points from, one of the indicated areas of need was mental health consultation. Many teachers said that that would be a welcome addition to what they currently have. And so we know that that will be a wonderful addition. Going on to the next one, we also know that children experiencing autism is very common in our area. Nationally, the autism prevalence is 1 in 36. And so we have been working with our Southern Oregon Education Service District, who has an autism team, to identify how we might work more closely with them. And so they have agreed to set up a phone consultation. Jordan, if you want to click to the next, there we go, to set up phone consultation hours for our teachers. And these would be hours that were convenient for teachers to call. So most likely after 5 p.m., where a teacher could reach out, schedule an appointment, and have some one-on-one time with autism specialists who could provide support, be an ear to listen to the challenges, to make suggestions, to provide resources that families might benefit from. And so these specialists would be billing for their time. And so it'd really be, we would be invoicing them they would be invoicing us for the time that they spend with these consultations. And the Early Learning Hub has about $2,000 to go towards launching this. And we estimate that it could be up to $10,000 a year. We really don't know. We're not really sure what the demand will be, but with any pilot, we want to offer what we think is needed and then look at the results to see if it's something that is working. So teachers would get that support. Children would be more supported with what's appropriate for their learning and development needs. And then families would be able to be more engaged as partners. So we're really excited about kicking that off. And then the next one is increasing mental health skills coaches in classrooms. And so last year we funded a pilot with Kairos Mental Health Services, bringing a skills coach into Head Start classrooms. Because what we had been hearing across the board is that we need someone to help work directly with children to help them regulate those big feelings. And so we wanted to pilot and say, what happens? Does it work if we bring a skills coach in? Is it meeting the intended need? And the answer was yes. The challenge is that it took a year for Kairos to find a qualified person to fill that position. So just like childcare workforce has a challenge with getting enough people in the field, mental health does as well. And so what Kairos has been doing with Head Start this year is identifying 10 early learning staff who are interested in earning a qualified mental health associate credential, a QMHA, to then be able to provide that direct skills coaching to the children in their program. And so the cost is over a 12-month period, and it's $100,000 for 10 educators. And so Head Start now has their team almost through, I think they're about halfway through that, that process. The Early Learning Hub has applied for funding through the Josephine County System of Care to replicate this for Josephine County providers. And so we would need an additional $100,000 to be able to offer that for Jackson County providers. And so the idea is we will not be able to get all of the mental health expertise that we need pushed into the classroom. And so our next best strategy is to skill up from within. And so what we're hoping is that we'll be able to, in addition to what Head Start is already doing, that we'll be able to build capacity within, 20 programs to support individual children's needs with that one-on-one support across Jackson and Josephine County. So super excited about that. And speaking of excited, I'm also very thrilled to introduce Subin O with Teaching Preschool Partners here to talk about a new pilot that will be launching in Southern Oregon in the spring. Subin, welcome.
Hi, welcome to my 3-hour lecture on 1980s education. Oh wait, wrong notes. Sorry. I am with Teaching Preschool Partners. I am one of the 3 co-directors of our organization. I'm also on the Early Learning Council. I'm an adjunct professor at Portland State University. Used to work for the registry. I've been in early childhood for quite some time, and I'm so happy and excited to be here. A few weeks ago, I made a trip down to Jackson and Josephine counties, met many of you here, and I'm sorry if I didn't make my way towards you, but I think I will be making my way towards you soon, because I'm excited to announce that after our outreach, Teaching Preschool Partners is planning on launching our first rural cohort in Southern Oregon, in Jackson and Josephine counties. So people aren't clapping it because they don't know who we are. So Teaching Preschool Partners is a organization where we partner with school districts to transform public education. We co-create models of high quality practice. And we see ourselves as bridge builders, connectors, thought partners, and professional development providers. We're all 3 of us co-directors are very experienced in adult education and working in teacher education. Now, having a high quality model, having local high quality models can serve a number of, it can support the many strategies that were already outlined here in the presentation today. We know that from research on social change that social change doesn't happen as a result of good information or even influencer strategies. Those aren't particularly useful. What actually moves the needle is when people see someone like them, close to them, doing the change that they might do. And when they see that change and experience it for themselves, see that it's possible, that it's doable. And that's why I was so happy to see so many local examples of amazing change happening. And I'm already thinking about the bridges that we can build together. Another thing that Teaching Preschool Partners does is we shift practice. And shifting practice is one of the most expensive, hardest things to do. And we challenge the status quo where people tend to separate rigor and play, academics and early childhood development. And we work in school districts to do that. And we're proud that we're in 6 school districts in a major partnership way, but we're also expanding into other areas with in working with smaller school districts, and that's part of what we're trying to do here. So in working with rural regions, we know that as part of expanding childcare, schools districts are already playing an important role, and they're going to play an important role in a mixed delivery system. And so seeing those local examples that other school districts can come and witness and even participate through practicum or through professional development activities is what we're trying to create. And this also connects to what some folks were mentioning around some of the challenging behaviors that are being observed in the classrooms, is that providing professional development at a conceptual level around the big ideas can help. It kind of sets the framing of what happens. But what really helps teachers is contextualized, individualized coaching around what they might do when confronted with some of those issues. And that's something that we provide. So the opportunity that is in front of us is in the spring, we'll be launching our first cohort. We are actively looking for who our first participants might be. We're planning on, again, doing it in your region with in-person events in March and June and online events in between then. What we hope is that this sets the stage again for more work to come, seeing that bridge building takes time and it only happens through relationships and that are enduring and sticky. So we hope to do that with you. So thank you, Renee. Thank you, everyone, for inviting us and allowing us to do this important work together.
Super, so excited. I tried to put the flyer in the chat and it's not letting me. So Subin, if you're able to attach it to the chat, that would be great. Otherwise, we'll make sure that everybody gets it. Wonderful. And then Jordan is going to quickly just talk about, we've explained all of the financial need. And in just a moment, we're going to go to the advocacy piece. That Jordan's going to quickly outline what donors can expect.
Yes, so we wanted to have some ways to express gratitude for those who are willing and able to come alongside us and collaborate in some of these projects. And some of the ways that we've thought to show our appreciation and gratitude is to give you a designation of a child care champion, logo, title on our webpage, on our social media, share out acknowledgements for anyone in our quarterly newsletter. Give them a decal for their business, for their website that shows that they're a child care champion, as well as gratitude posts showing how their funds are being used, and being invited to our appreciation dinner that happens every 2 years. So I wanted to show you our webpage really fast and be super brief. This is the SOELS website, and I will put a link in the chat. If you are interested, you can navigate to the donate tab, and it is broken down
16 ounce coffee.
It is broken down by each of the bodies of work that you've heard discussed today. So you can toggle and find a little bit more information as well as how you can be involved in that.
Thank you so much, Jordan. And in our final moments, I'm super happy to introduce Dana Hepper. Many of you know her work as an exceptional child care champion with Children's Institute. Dana, thank you so much for joining us, especially while you are on the road, to talk about the power of advocacy.
Thank you, Renee and all. I'm so happy to be here. My commitment is you will be done by 2 o'clock. But before I talk too much, I just want you to move your body in one way that feels good to you. You've been sitting for almost 2 hours. We would never ask children to do that. So
and Dana,
your hand, stretch your shoulders.
Tomas is also reminding us to talk slowly.
Thank you.
Thank you.
I will do that. My name is Dana Hepper, and I am the Director of Policy and Advocacy at the Children's Institute. Children's Institute envisions an Oregon where all children have the love, care, and education they need. And we are working alongside all of you to make Oregon the best place to be a kid. Can someone advance the slides? Thank you. And the next one. Thank you. This has been an amazing time to learn about all of the work that you are doing in Jackson County. And what I can add is some statewide context and opportunity, because you're a part of a growing movement of people like you across Oregon who are making our communities a better place for young children. So I'll briefly share some statewide data, some statewide progress, and some action steps that you can take. Next slide. So if our work is making Oregon the best place to be a kid, how are we doing? And I won't belabor this, but you know we have work to do. A huge percentage of young children grow up in poverty, and at a time when their brains are most rapidly developing. In fact, this is the population of Oregonians most likely to live in poverty. And yet their parents are working and likely need childcare, but as you've just heard, that childcare is often not available or affordable. Next slide. Thankfully, just like you've been hearing today, there is good news across our state, where communities are taking a look at their local data and making local change. In Yoncalla, a town of about 1,000 people in Douglas County, the school district and families have worked collaboratively to build a thriving preschool open to all 3- and 4-year-olds. In Gilliam County, the county commission has invested the funding they've received from wind turbines in becoming the first county in the state that isn't a childcare desert for infants and toddlers. And of course, right here in Jackson County, in Josephine, there's a star there too. You've just been hearing about all the amazing innovation you are undertaking for children. Next slide. As local communities are taking the lead, the state legislature and state agencies are learning from what you're doing, lifting up those lessons to inform statewide action. People from across Oregon have come together to advocate to legislators, and we've had some amazing wins. This is just a sampling of the last 4 years. The legislature has doubled the state's investment in early learning and childcare. We've been improving Oregon's childcare subsidy program to work better for children, families, and providers, and I'll come back to that in a minute. We've been investing in culturally specific early learning services with the first in the nation Early Childhood Equity Fund. Just last session, we secured $50 million to establish, expand, and improve early learning and childcare facilities. And you heard about some of the amazing work happening in your community to create accessible pathways into the childcare workforce. And your work has served as a model for workforce pathways that's being scaled statewide. This is incredible work for children, and it is the most important work that we can do. So many places in our communities and statewide are sharply focused on housing and addiction and behavioral health. And of course, these are immediate challenges in our communities that require solutions. But at the same time, I want us to remember that so often addiction, behavioral health, houselessness can be rooted in the experiences of trauma that people faced when they were young children. And this work is about preventing those experiences that increase those risks of later challenges, and about filling children's lives with the positive early childhood experiences with their families and with their early educators that build their resilience and hope for the future. This is exciting progress, but we are not done. Next slide. As you all know, on November 4th, Oregon instituted a wait list for our childcare subsidy program. So this means that families who seek help paying for childcare and are eligible may not receive that support. In a way, this is good news because, you know, families have needed childcare forever, but we didn't have a childcare subsidy program that was really designed to effectively serve them. Now, we've made changes to our childcare subsidy program that have improved that program. Those changes are working. And so what we saw was an unprecedented wave of families signing up to get the support that they needed that now functioned in a way they could use it. But this is also why we have run out of money for this important program. So, so in order to lift this wait list, the state will likely need to make a significant investment in our childcare subsidy program, potentially in the ballpark of $250 million. So as you do this critical local work, I also want you to think about taking statewide action. So of course, you're already taking the first step. You're learning about your, many of you, as you said in the poll in the beginning, are already very knowledgeable about the childcare crisis. That's an important first step. If you want to stay engaged in what's happening at the state level, Children's Institute would love to help you do that. I'll put in the chat a quick link. You can sign up for our updates. That's an easy step. If you want to get more involved, I would love for you to shoot me an email. And we'll get on the phone and you can talk about how you'd like, we can talk about how you'd like to be engaged and how I can support you to do that. And now that you're involved, I think you can also talk to your peers, talk with friends, neighbors, colleagues about the need for early learning and care, listen to their experiences, and talk with those folks that are making the decisions about funding and policy at the city, county, and certainly at the state level. Share with them why childcare matters to you. I'll put these slides in the chat too, because there are links there for a template for how to get your story into a digestible format that can be used for testimony and meetings, etc. And with that, I'll say thank you. Thank you for having me here, and thank you for the work that you're doing.
Thank you so much, Dana. And Dana will have a lot of resources that we will continue to share out. And Jordan, if you want to go to the very last slide here, we've talked about a lot. We're at the finish line now. So really we're asking for two things. We're asking for advocacy. And there is such power when people outside of the early learning field also reach out and with the message that childcare matters, that supports for families and children matter. And we also have underscored the need for financial support to scale up a lot of the strategies that we have, and wanted to emphasize again that 100% of any donation that we receive goes right back into the community to those strategies that we outlined. And we're just super grateful that you sacrifice 2 hours of your time. We will be following up with you. We will get this slide deck to you. We will get the Q&A document to you. We will make sure that you have Subin's flyer, as well as all of the advocacy materials that Dana has available. And we could not be more grateful for the turnout today, beginning of the conversation. It is through this collaborative spirit that we will start to make a difference. We know we can't boil the ocean, but we can really make some significant inroads into addressing our childcare crisis and showing our families and our childcare workforce that they matter and that we care about the issues that are important to them. So with that, I'm going to say, have a great afternoon. Thank you again, and keep this conversation going. Talk to as many people as you can. Have a great day.